As the cholera epidemic continues to contaminate and kill children and adults in all 10 administrative departments of Haiti with no sign of containment and compounded with the lack of access to safe drinking water, South News spoke to William Fellows, Unicef's WASH Cluster Coordinator on water, sanitation, and hygiene programs to gain an understanding of what's occurring on the ground.
121,000 people had been affected, and 2,591 had died. Of that, approximately half would be children of the affected, because in a normal cholera epidemic, more children would be affected because adults would have been exposed in the past. But because in Haiti there's been no prior exposure, at least for 100 years, it's running right through the entire population.
UNICEF reports that mortality rates of children under 5 are highest in Haiti as compared to the rest of the Western Hemisphere. At least 1.5 million Haitians are living in temporary shelter, and others are constantly on the move.
We're still in emergency phase from the earthquake, and now the cholera epidemic is still, we're still in epidemic phase. So at the moment, the epidemiological curve is actually not running a normal pattern, because it's not a normal situation. Right at the moment, it's running actually quite flat. So the rates of infection are pretty much the same day to day. Now, how long that will last, we don't know.
The Red Cross reported that 46% of homes survived last January's 7.0 magnitude earthquake, but Haitians are not yet convinced to move back into damaged yet safe homes. Latrines are being built, but without good information about ground conditions, making it impossible to build functioning water systems.
In the Arbonite River basin where it first broke out, it probably was in the water supply because people were drinking surface water, and the surface water probably became contaminated. But as people spread around the country, other vectors such as personal hygiene, food hygiene, or funeral practices were probably more important vectors. 17% of the population had access to basic sanitation. And that was a number that was actually dropping. The number was coming down over time. So the earthquake woke us up to the fact that we had a serious development problem in Haiti, and we started working very seriously on sanitation, but still we have a lot to do.
According to the United Nations Office of the Special Envoy for Haiti, of the $897 million pledged in the aftermath of Haiti's January 12th earthquake, $209.3 million has been pooled in grant funding to the UN, Inter-American Development Bank, and the World Bank through the Haiti Reconstruction Fund. Haiti's real answer to sustainable water security will only come from an overhaul of its public infrastructure, and that will only come through political will.
Gearing up the social mobilization and the hygiene education, at the moment we're reaching about 800,000 people with face-to-face communication, getting the word into the street at the mass communication level, getting the mass communication to send out the messages of how it's not being passed. It is not voodoo, it is not witchcraft, it is not evil spirits. It's a scientifically verifiable disease. We know we know the means by which it can be transmitted. Getting that knowledge out and then getting the behaviors in place to break the transmission. That's where we're really putting our focus.
Worldwide, it is estimated that just by improving sanitation facilities could reduce the number of diarrhea-related deaths by more than 1/3. Afaf Kanja, South News, UNICEF Headquarters, New York.